because I want to talk about the employee who are the average person watching. Then I want to come over because we have a subsect of people who are like me.
Business owners and freelancers.
Yep.
Yeah.
And finding insurance for me was very difficult.
Yep.
Because I didn't know where to go.
Start.
Right. And so, but let's come back over here to the employee. Open enrollment time.
Oh, yep. Hunger Games.
It is, right? What are things that, what would you say that the top 3 most important things to know? If there's 5, give us 5. But what would you say the top 3 things that we need to know during this season when it comes to open enrollment?
I would say number 1, knowing when open enrollment season is. Open enrollment season is from November to about January.
Okay.
But also, it also depends on qualifying events where you can join other times of the year. It also depends on if you've lost your job recently. Those things also qualify in open enrollment. But more specifically, open enrollment is typically between November and January. So before that time, you should be budgeting. That'd be probably number 2, to figure out, okay, when I look at the marketplace based on my zip code, because that also matters, where you're located. Your rates are different. But yeah, when you go on the marketplace, you have to put in your zip code. That's because the rates are different. See, it's the sneaky, tricky things that you don't know that are going on behind the scenes. But essentially, you need to know what the comparisons are so that you can prioritize what's important to you. Which category do I fall in? How much am I going to use the services? So then I can budget and plan for that open enrollment period. And I have my money prepared for when I'm ready to sign that contract. And then read between the fine lines. Know the terms and understand what those terms mean so that you don't sign a contract that doesn't align with your priorities for your health.
What's going on, fam? Hey, listen, if you're serious about getting out of debt, building real wealth, and creating a life of freedom, this is your home. I want to personally invite you to subscribe to the channel right now because every single week we're dropping videos that will help you take control of your money. It will help you shift your money mindset and break money generational cycles. You see, this channel isn't just content. It's honestly a movement. Over 1 million people have joined this community over the last 4 years. I'm still blown away by that, to be honest. And our mission is bold. It is to eliminate $1 billion in debt and build $500 million in assets by the year of 2050. We talk real money, real freedom, and real legacy here at the table. No fluff, no credit card hacks, just the truth that will set you and your family up for a better financial future. Do yourself a favor and join this family, join this movement by hitting that subscribe button, turn on your notifications, and join this journey because this is where financial freedom begins. Let's get back to the show. Hit that subscribe button.
People don't always think ahead, and sometimes, in that open enrollment period, you want to make sure, like, if you're a woman and you're like, okay, me and my husband are thinking about having a baby, in that open enrollment period, there are certain questions you should be asking. You shouldn't automatically go to the cheapest option. 93% of people will re-enroll into the same plan and not even look at the other options.
Won't even
possibly
look.
Saving them money.
Yeah.
They just automatically re-enroll because they don't want to take the 20 minutes to educate themselves on the different plans that are out there and how those life changes. Preemptively thinking about those life changes can affect the type of plan they use. Like you said, a single person with no kids who may be an employee versus a person that may have a family that's employed somewhere. It's going to look different.
Also think about age, right? Because at different age groups, you're going to have different screening and testing that's recommended for you. So maybe you're younger, you don't need as much screening and testing, but as you get older, your thought process should change as far as, okay, I'm going to need to see the doctor a little bit more regularly, especially if you have a family history of cancer or a family history of other chronic diagnosis or prognosis are poor. You want to think about that family history. We don't talk enough about our family history in our families, but we should, because it's very important to understand as far as how our outcomes will be later on in life.
No, that's real. I think when I first got connected with y'all, I had a conversation with my parents. So I need y'all to tell me the truth. You know, on one side of my parents, diabetes is real big. On the other side, prostate is real big. And so it was a very hard conversation.
It is.
To know that, okay, diabetes on one side, prostate on the other side. Jesus. And that's a lot.
Tough. It's tough.
But the spiritual side of me kicks in. People perish for the lack of knowledge.
Right.
And I think that a lot of us are perishing or getting sick. And I'm just saying the truth, because we are fearful to get the knowledge. Once I know what I can possibly face, I know how to possibly prepare for and attack it ahead of time.
Yeah.
And I think Black people, we just got to get better at that.
It's like having on the armor of God, right? Have that armor on, you're protected.
Yes.
Here is the truth. I am always looking for practical ways to help you build, right, wealth, specifically generational wealth and legacy. And one of the best ways you can do that is with life insurance. That's why I've partnered with my friends at Ethos. They make buying life insurance simple and hassle-free. Whether you're the main provider for your family or want to make sure your loved ones aren't left with financial burdens like debt, life insurance is a powerful way to provide financial security. As a business owner and a homeowner, I took this seriously and secured a $2 million life insurance policy through Ethos. Why? Because having a peace of mind, knowing my family will be cared for when I'm no longer here, is extremely priceless. What I love about Ethos is their quick and straightforward process. You can apply entirely online in as little as 10 minutes. I'm not even exaggerating. I did it myself. Listen, no medical exams, just a few health questions that you must answer honestly. Plus, it's affordable, making it easier to protect your family without breaking the bank. Listen, I want you to lock in your rate today by visiting anthonyoneal.com/life insurance or click the link below to get your personalized free quote today. Listen, as we're getting back to the show, I want you to protect your loved ones. Don't play around with it. Be like me. I promise you. It's a hard conversation to have, but you will sleep peacefully knowing that you took care of your family. Go to anthonyoneal.com/life insurance. Let's get back to the show to help you keep building this wealth.
So we talked about the employee. What about someone like me who is self-employed? And for me, it was difficult to find good quality health insurance. And to be honest, listening to you all more and learning more about it, I may need to go back and do some research myself.
Yeah.
Just to be honest and transparent.
So in a comparison chart.
I mean, I'm paying $98.
Right.
My deductible is $6,000, right? But I'm like, do I have the right plan? After listening to what you all have been teaching me over the last couple of months, I'm like, okay, this season, when it's enrollment season, I'm going to do some real good research between now and then. And I may be going back to change it. But what do you all recommend? Ooh, now I didn't prep y'all on this one. So if y'all don't want to answer, don't answer it. But there's these insurance companies out there that are saying, hey, you might not be able to afford this insurance company, but come over here into this company. I forgot what it's called. It's like a Christian health insurance company where you donate money in and then it's like it's a big pool. And if you have something, then all that pool goes to you.
Right.
What is that called? And would you say that is a legit option out there?
It's a form of, so let's take a step back. So there's something called direct primary care, which is what you're in, has entered into with me and Dr. Thompson.
Yeah.
In which, if people don't know out there, it's essentially where you're paying a membership every month.
Yes.
We're not billing your insurance.
Right.
Which is different from concierge, which is like an MDVIP, where they bill your insurance and then also charge you an annual, monthly, yearly membership. Right? The Christian plan that you're referring to kind of comes alongside the direct primary care concierge route, where it's another cost sharing benefit type situation, as I explained earlier. So it's another pool of money that somebody who has a plan that's affordable, like a DPC plan or a concierge plan, their physician can tap into that money for them.
And you're going to see these companies popping up here. Every time I go and I'm researching for myself, I find companies popping up here and there, whether it's concierge, direct primary care, and you're seeing what they're providing for patients. I mean, the state of healthcare has to change because we are in a healthcare crisis. We don't talk about it enough, but we are. And so with that state, we have to provide more resources for patients to be able to access care. That's kind of going into the access. And for the people that want to invest and prioritize their health, then they're going to invest in plans like that so that they're going to be able to have coverage outside of their employer if they are a solo entrepreneur.
That is good. Now, if they don't do that in plans like me, what would you all say? Is it going back to what you all said earlier? Because I went to healthcare.gov to get my to the marketplace.
Right.
And I mean, it's pretty decent. I mean, but here's the thing, I haven't really used it.
Right.
Because I've just been paying just the monthly, just to have it.
Just to reach the deductible.
Yeah, just so catastrophic, basically, so that way.
Right. Definitely. But as I'm getting older, I'm 41 next month. Should I be looking into something different at this age of my life?
I think you should optimize your plan based on your age.
Okay.
Absolutely.
Okay.
Because your screenings are going to change.
Yeah.
You're going to start needing a colonoscopy. You're going to start needing more frequent prostate evaluation.
Yeah.
And unfortunately, as we get older, life starts to hand us some things.
It does.
You know, the other day my hip was hurting and I'm like, oh, what's this? So you start to get some surprises as you get a little older. So being prepared again for it is important.
Okay. And how flexible you want that to look for yourself, right? Like if you want a specialist that's outside of a network that you're being referred to, that would also guide what type of plan you use. Like she was saying with preventive care, colonoscopy, there might be a specific type of GI doctor that you want to go to that might not be in the plan that's in your network. So then you want to look at something like the PPO, as was mentioned earlier, or even something called an EPO.
Ooh, see, you keep bringing you brought up POS earlier. Now we're going to E.
I'm trying to.
Alphabet.
Yes.
What is
the
EPO?
Exclusive Provider Organization.
Right.
Okay.
So that's a little bit of step down from a PPO, where you're still in network, but you don't have to go through your primary care doctor to get a referral.